Okay, well, hello everybody. I know everybody's joining. We just started. We're a little bit late. We were both seeing patients, so we want to welcome you. I'm Dr. Roney. This is Dr. Connealy here, and this is the third episode of our second season of the Cancer Conversation. And tonight it's going to be a hodgepodge of questions and answers. So we're going to jump right in, and we're going to start answering questions. That way we can get to as many as possible. So if you do have questions, gang, you can put them in the Q&A section. The chat section is not where we'll be looking for the questions, but in the Q&A. So we're going to get right after it. And I'll introduce Dr. Connealy, and she always has a good intro. So we'll let her take over.
Well, first of all, happy Valentine's Day.
Yeah, true.
And I want to wish everybody to fill their heart with lots of peace, love, and joy. Because that's what you need and that's what the world needs now. And I appreciate every one of you who are listening, and the ones that are going to listen, and the ones that you're going to send it to all your family and friends and loved ones. Because as you know, we've got to change the existing paradigm of medicine today. And people, don't realize what's available to them until they go on a discovery quest to see what can possibly help them. And then once they start diving in, one thing leads to another. And we hope to be the answer and or the question for you, because, life is always full of discovery all the time. And so we welcome all of your input at any time. I had a patient today, brand new patient with breast cancer. And I said, if it takes you consulting with 10 people, that's 10 heads with 10 different perspectives and 10 different lenses. And I said, it's all to get you well. And so we as physicians need to be open to the universe to really, look at every possible avenue. It's echoing. So anyway. So thank you for being part of our journey today. And thank you for helping us continue to awaken, enlighten, and inspire and educate you and all of your friends and all your loved ones and anyone else who wants to learn more.
It's a movement, gang. We're trying to create this movement so everybody has the most optimal opportunity to get better. And so the more you know, the more you're empowered.
Right.
And the better chance you have. So
yeah, and it was interesting. I get these emails about medical topics. And so the title of the topic was so good, and it was saying like, oh my goodness, we should not be practicing medicine like this. We should be, really focusing on prevention. We've got to change the paradigm and everything. So I said, I've got to watch this. I've got to watch this lecture. Now, most of the lectures that I've listened to, they're for medical doctors, are on conventional medicine, but there have been a few implementing natural things. So I thought, okay, so I'm listening to the cardiologist talk about heart disease, because heart disease is still the number one killer. Cancer is number two, and they're neck and neck. So you want to know about cancer and heart disease, since those are the diseases that are most prevalent in our society today. And so I was listening to him, and he's going through, and he says, well, the real thing that doctors need to be paying attention to was LDL cholesterol. And I'm like, well, 50% of patients who die of heart disease have low cholesterol. So it can't be the end all. That cannot be the end all. So anyway, I said, he didn't talk about teeth. He didn't talk about nutrition. He didn't talk about exercise. He didn't talk about stress. He didn't talk about all the things that we're addressing with you that make up the whole biological entity called the human being.
Mm-hmm.
And so He didn't talk about infections. Like infections cause a lot of inflammation in the cardiovascular system.
Mhm.
So, I still continue to be amazed that the information on PubMed is there. The information is out there, but we all of us need to seek for it, look for it, and every day, constantly. So anyway, I always give the analogy. I said that's like you raise children and you only do one thing. Well, any mother or father out there knows that it's hundreds of things that you do to raise a child. And the miracle of the 50 to 100 trillion cells we get to live in is truly, truly complicated, complex, and miraculous. So one little thing cannot change the course of a serious disease, whether it's heart disease, cancer, autoimmune, or any other diseases.
We always say it's this, that, and the other thing, right?
Right.
It's looking at this list and this checklist of different causes and different contributors and trying to work through that pragmatically. And then the less you have, to your point, you always say, peel back the layers of the onion, the less causes or the less fuels to the fire, if you will, that create that inflammatory process, the better off you're going to be, the better chance you have.
Right. And
so
it is a process
Mhm.
because I saw a new patient a couple months ago, and she has B-cell lymphoma, and she got conventional chemotherapy. So she says, I want to do everything I can not to have this cancer come back. So she came here, and so I told her, I said, you're going to be overwhelmed because she's a lot to do in the beginning.
Mhm.
Because if you do those things on a regular basis, you're not making up for lost time. So when I did her consult, and she'd already had a consult with me and Dr. Rowe and Dr. Roney. And so I was getting her on her next phase of healing. And so I said, in the beginning, it's a lot because you haven't been doing this for 10 years.
Right.
And so I said, but we're going to slowly deliver it to you.
Mhm. Create habits.
Yes. And it's still going to be a lot. And then it gets simpler. And I said, but give yourself 1 year from the time you start to a year from now to master your self-healing and your protocol to how do you take care of yourself? Because I always say self-care is the new healthcare.
Mhm.
And so that's what we try to do, is try to help you along the way. And so hopefully tonight we'll shed some light on some questions that people have. So I got a few of them.
And I'll pull up the Q&As, gang, too.
Yeah, so maybe if that could be helpful too,
Mhm.
because so one of the questions was, do you see any successful liver metastasis shrink partially or totally by doing IPT based on personalized RGC chemo recommendations? So first of all, it can be successful. Usually when we are doing treatment, we don't rely on one treatment platform.
Right.
Okay. We want to do as many different platforms as we go along. So we just saying you're just going to be doing chemo and hopefully it shrinks. We won't do that, because if you don't change the environment of the cell, then the cancer can't be removed from the system.
Mhm.
So you might shrink it with a surgery, chemo, but to totally change a patient with cancer, you must change the
terrain.
environment and the terrain of every single cell. And remember, it's 50 to 100 trillion cells. And you do not live in a petri dish where we're controlling the medium of the petri dish. So we're living in this world of, environmental toxins, air pollution, endocrine disruptors, and plastics and oil, all kinds of things. So we have to get rid of the influencers that cause the environment for disease to take place. So, and then when people recommend what percent of your cases, my philosophy is every individual is an original. If you get as many healing platforms as you can and supportive treatments, because if you have cancer, you have to have the healing platforms, but you also have to have the building health platform at the same time.
Mhm.
Okay. So if you just go attack and create war with the cancer, and you don't take care of the patient in the process, you're going to damage their immune system, their gastrointestinal system, their nervous system, their kidney system, every system.
And quite frankly, that's the approach in the medical world, right?
Right. That is the approach.
Not that we're not saying it's bad. It's limited.
Right.
It's going after the cells, but not looking at the causes, not making sure the body's oxygenated and alkalized, and you're boosting the immune system with different modalities and techniques, if you will. And then, to Dr. Connealy's credit, going through the causes, that something had to create this cell or these cells to replicate abnormally, right? And to your point, I should say, that's where you get into the inflammatory process based on these fuels to the fire, the infections in the body. Sometimes your food can do it. Sometimes your gut health can do it. Sometimes it's toxins and chemicals and stress and all these different things. If we're not changing that, to your point, the body, it's going to be hard. You might get rid of it initially, right? If we just beat up the cancer cells with, say, chemosurgery, radiation, fractionated chemo. But if we don't change that terrain, the chances of reoccurrence go way, way up. And that's what we're seeing. That's what happens, which is why the clinic is here pretty much, right?
Right.
So,
because we've got to address every single level and then keep that addressed. For example, if I told you had diabetes today, and then you went on a ketogenic eating program and you cleaned up every single thing and you exercised, et cetera, I'd still be checking you to make sure that you're not diabetic.
And keeping you on that
protocol. Yeah. It's not like you can go and have, bonbons and cupcakes and not exercise. You still have to keep it going.
Yeah.
So anyway, that same question the patient says, and also using hyperthermia. So we have 3 heat shock proteins, 27, 72, and 90. And those can be activated with hyperthermia. Hyper means high, thermia means temperature. So high temperatures. So usually hyperthermia works very well with low dose chemotherapy or fractionated chemo.
And we typically recommend those two together almost across the board, right?
And it's good for someone not even receiving chemotherapy,
right?
Hyperthermia.
Yeah.
So heat is very, very good for your body for getting rid of infections and cancer. So we highly recommend the synergy of both of those.
And sauna can be a form of hyperthermia, right? Your infrared sauna. Yeah,
exactly.
Yep.
So a patient asked, could you shrink liver metastasis without chemotherapy? Well, I anything's possible. I wouldn't recommend a patient wait to see if that's going to happen. I would be telling the patient, if they had liver mets, that we are going to do every single thing to shrink those tumors in the liver. So I would not probably recommend it with the natural known agents of anti-cancer that have anti-cancer capability, like vitamin C and quercetin and agaricus and curcumin, et cetera. So I would not just recommend natural things.
And that's because certain cancers in certain tissues, right, have from your experience or from anybody's experience, they're a little bit more quote unquote aggressive, right?
Right.
So that's why it's all about what's presented as to what the recommendations would be. That might not be true for all of them, but for liver, I think that's safe.
Right.
Fair. Yeah.
Right. So this patient says, I'm 58 years old. I had a thyroidectomy and radioactive iodine at 28 years of age for thyroid cancer. Still have a few positive nodes in my neck, and they monitor every 2 years at Mayo Clinic. So first of all, thyroid cancer should be, if you have a few positive nodes, you need to be treating that. So this patient, I don't know because I don't have a scan or anything, but if you still have, theoretically, thyroidectomy and radioactive iodine is usually in the conventional world universe that is curative for thyroid cancer. But I have seen many a patient be stage 4 thyroid cancer because they said, oh, you're cured. But as you guys know, there's circulating tumor cells. So we have to go after the circulating tumor cells, but more importantly, we have to create health in the patient.
Yeah.
Again, you've got to say, why did the thyroid cancer begin with? Was it a combination of environmental toxins, stress, dental mercury fillings going down to your, neck and intoxicating the thyroid? So you see, so all those things. So you're monitored every 2 years at Mayo. You need a good workup now, the way we do it.
Yeah. And it's great that you're monitored, and they would call that probably active surveillance, right? Something like that. They might use that term, but are you actively doing anything to clean up the environment? And that's really the critical element, because there's that active surveillance, but then there's active participation in your health. And that's, I think, the mantra that we would probably say. Start looking at things like Dr. Connealy said, as far as what could be going on that created it in the first place, and be actively involved in cleaning that up. That's going to give you a better chance of those scans staying negative, or even the nodules can be
reduced.
Resolved.
Exactly.
Yeah, absolutely.
Correctly. So one of the patients asked, if my RGCC test was 0, how can nagalase be formed? Any chronic illness can cause an elevated nagalase. So it could be chronic heart condition. It can be viruses. Many other chronic infections can create nagalase level. So that is a great question, though. So it can be a good screening tool for a lot of things. So this patient is 1B cervical cancer, had a radical hysterectomy, now NED, which means no evidence of disease, no residual tissue, no further treatment. What next? How do you get rid of HPV? So first of all, that's great news, number one. Number two, you also still need to evaluate your hormones. You need to, again, go through the checklist of root causes, just like we were talking about. Is it yeast, fungus? Is it parasites? What contributed to this perfect storm? Mold, heavy metals, elevated sugar, elevated inflammation, low vitamin D, all these things, okay? So your doctor needs to do a complete workup. And if you live in Canada, which it looks like you do, they have a socialized system, so they don't do all of this. You have to find a functional medicine practitioner in Canada to, to address all of these root causes and underlying things that I talk about in my book.
And invest in that.
Yeah, you
really,
have to.
You're going to have to look at it as an investment.
Right. But I know in Canada, because I have other patients in Canada, and there are functional doctors, and then you can, of course, work with someone here. Now, the same person said how to screen for head and neck, anal, and vulval cancers from HPV. Well, HPV, human papillomavirus, is a virus common in many people of the population, can contribute to the development of cervical cancer and over 50% of head and neck cancer. So what I would do is, one, you need to address the HPV, and that was your other question. So the most important thing that I've used for HPV, first of all, you can do ozone. You can do it ozone through intravenous, vaginally, and rectally. So that's very good to help get rid of viruses and oxygenate your body. But the other substance that I've used is something called Essential Detox. And Essential Detox is a special formula. And usually what I do is I have the patients take 3 times a day for like 3 months. And then I decrease the dose to 3 times a day. And then I just go down for 1 year. And then I keep them on about 2 pills once or twice a day. But it takes about a year because HPV is deep in the tissues. So it's a kind of preventive thing that, actually a lot of people, because there's a lot of young people now with HPV. So it's a very important thing to address and deal with. And so that's, so that's what I would recommend that you do. There's no good screening for head and neck cancer other than going to your doctor and physical exam. So that's going to be difficult to do. You can do pap smears, but now you had a hysterectomy, so you don't have that. So you're going to have, there's we do very specific things here for screening. So.
Yeah. And in addition to any type of virus in the system, the more other things that are going on, the more those viral loads can go up. So you kind of have to take away some of the other things going on in the body so that immune system has a better ability to fight that specific viral load. That
Right.
fair? So
Right.
it's other things too. Okay. Stress and hormones contribute to disease, especially cancer.
Yeah, so stress is a huge conundrum for everyone. And so stress, what happens is we have our adrenal glands. Our adrenal glands sit on top of your kidneys like little hats. And the hormone, when we get under stress, that's increased is something called cortisol. And cortisol suppresses the immune system, but it also just makes the cancer spread and cause havoc in your body. Now, if you have occasional stress, that's your body can recalibrate. But when you have chronic levels of cortisol, it's very damaging to your body, elevates your blood sugar, interferes with digestion. I mean, it just causes this, runaway train effect of destruction in your body. So that's why they tell you not to take steroids, because steroids are very, very interfering. They suppress your immune system. They cause, so many other effects, and really they're destructive. So that's why you may take it if you had an acute situation, but it's not the kind of thing you continue to take. Steroids, which are really toxic forms of cortisol. And so you would not continue that. And you don't want to get on a roller coaster of needing steroids. But your body can make it yourself. But then, so that's why we do a saliva cortisol test to evaluate if you do have chronic levels of elevated cortisol, because your cortisol level is high in the morning, a little bit lower at noon, a little bit lower at 4, and much lower at nighttime, very low, because that's when you're asleep, and that's when your body goes in repair and regeneration.
And that's one we run just about on everybody these days, right?
These days.
Yeah.
So what testing do you recommend for a 40-year-old female to prevent cancer? That's a great question. So what I would do is comprehensive blood testing. Then I would do, you could do the liquid biopsy, which is called OncoTrace. And then for breast imaging, you can do ultrasound and thermogram. They recommend mammograms sometime between 35 and 40 years of age. So most women start to have around 40 getting a mammogram. Mammogram looks at calcifications, a breast ultrasound looks at lumps and bumps, and a thermogram looks at vascularity. So, and the other test that we do here called the bioimmune survey, Molly's been on before, but I'll make sure she does a updated of her protocol. But you have acupuncture points on your fingers and toes that correspond to every organ in your body. And this acupuncture tells us the energy flowing through the acupuncture meridians. And then it will tell us what's impeding the energy if your energy level or your energy flowing through the acupuncture meridians isn't well. And so we do that. And then we do part of that protocol, which takes about an hour and 15 minutes, is looking at something called the cancer cascade. And you can go on YouTube and just look up cancer cascade and look at further how we do it in the clinic. But that's a timeline because cancer is a 10-year disease. So from one cancer cell to tumor is 10 years. And so those, I would say a good blood test and that bioenergetic testing, we know a lot. And that's a very inexpensive way to go.
Yeah, agree.
So help for breast cysts. So the best thing that I like is iodine and correcting your estrogen overload or estrogen dominance, if you have that. So not every woman has it, but I would say in the world today, since we have so many chemicals that are estrogen mimickers, we have more, I would say more hormonal imbalances manifesting as endometriosis, breast cysts, fibroids, etc. So I would recommend that you do iodine on the breast. Iodine is good for every single cell in your body, but it's beautiful to help assist. And then you would get an evaluation of your hormones to see if you have estrogen dominance.
Dutch test, physician's lab, good one. Urine tests,
Right.
good ones. Let's see. Type 1 invasive lobular breast, successful lumpectomy, great. No cancer lymph nodes. Do I have to go on hormone blockers now? Good question.
Yeah, so this is a patient that has a breast cancer that is estrogen receptor positive, which most breast cancers, about 65 to 70% of breast cancers are estrogen receptor positive. And so I would recommend for the first couple of years, I'm not sure how old you are. So, but you should go on some form of estrogen blocker. The typical ones, if you are less than 50 or not menopausal, you go on tamoxifen, and the studies show that 2 years is the mark for going on estrogen blockade. Now, the other drug, anastrozole or letrozole, are the other medications that are used for women in menopause. So I believe in the beginning you should, and then work with your doctor to, on a certain period of time until your body has gotten completely stabilized. So, because in this day and time, we have just too much estrogen feeders. So we have to be more on the side of caution. So,
Best test besides RGCC. I think you answered that one above as far as what are the best ones.
right.
Cause fractures, make it difficult to travel. See therapy, help build bones. So come to your center.
Bones,
yeah.
So definitely, so she said, what is the best test besides our GCC, cancer profile and the cost? Well, the best test, if you don't, would be do comprehensive blood testing with the bioenergetic survey. Then Merigen, yes, if you have bones, very bad bones and cause fractures, then you should definitely start that special product called Merigen. It's an ionic calcium. So yes, I would definitely do that.
Try to get some weight bearing exercise is always going to be good. Bone remodels distress, so that's a good one if you can.
And hormone evaluation,
Yeah, it is
parathyroid evaluation. I mean,
big.
again, it's comprehensive blood testing. If you don't look, you can't find. So you've got to do that testing. If you have a chronic medical issue, all the physicians need to do a very detailed. Your physicians need to be doing a detailed analysis of your blood work. So,
Yeah, the answers are usually not unilateral, right? It's usually not singular, I should say. There's multiple factors that if we're hitting it from a bunch of different ways, if it's looked at properly or evaluated properly, have a great chance of reversing that. Multiple stage 0 melanomas, how to prevent reoccurrence outside of sun protection.
Well, first of all, if you have melanoma, you want to make sure you don't have circulating tumor cells. Number one. Number two, you need to clean up your insides. There's skin grows from the inside out. So you need to figure out why, and then stress. You have to address stress because, and nutrient deficiencies and,
mold and toxins, and chemicals.
What's causing this, So there's always one or more reasons. Most people, first of all, need to do a cleanse. Second of all, most people have candida. In fact, they had a big article in Wall Street Journal about how the incredible rise in fungus. Okay. Now they related to the temperature changes. Well, personally, I disagree. I think it's due to, first of all, a lot of people take steroids, they take antibiotics, they take medications that all increase candida. Okay?
But their guts are pretty slammed. Most people's guts are very compromised.
Very compromised. And so then you add toxins, and toxins, fungus grows on dead decaying matter. So if you unfortunately, because of toxicity, you have dead decaying matter in you. That's why you've got to clean your system up. And we send out, I know Shep sent out a whole thing I'll tell you right now to reiterate it, probably the best single cleanse that we employ on the patients is something called the 21-day standard process purification. It's a eating cleanse. It's not a starving cleanse, it's a eating cleanse. And so the patients, I have to say, do well, obviously, to supplement with that, doing infrared saunas or baths or skin brushing. But we need to do, unfortunately, to live in this world today, that's what needs to happen. And, you can do little things, regularly. You don't have to maybe be 7 days a week, but pick a couple of days a week of doing things. But the 21-day cleanse once a year would be like a great
Good start.
start. And then you can get on your day in, day out with personally, like how you're eating, avoiding foods that have a lot of chemicals and toxins. And then doing either infrared sauna. And if you don't have infrared sauna, then we do the baths, and we use 2 cups of Epsom salt, 1 cup of baking soda, and clay. So clay's been used for years for purification and detox.
Optimal level of D, high vitamin D lead to liver toxicity. D is 76, that's fine. High of AFP, 11 UGs per liter. Am I concerned?
Well, vitamin D level seems okay. I have never seen anybody be toxic with elevated levels of vitamin D yet. I've noticed they have it, and I tell them to decrease the level, but I've never had anyone that has demonstrated any toxicity of vitamin D. Now, if you have an elevated alpha fetoprotein, someone needs to do a complete workup on you. And so that's a marker for many times for testicular cancer and cancer in the liver. So someone needs to do I'm not sure, a full workup if you have high AFP. I have seen that before, though, also in patients. And then once we worked them up, it wasn't anything significant. But, I would definitely, find a physician who can partner with you to do a complete workup.
So triple negative.
So triple negative is the most aggressive breast cancer. So you've got to do everything. You've got to do the conventional chemotherapy with the support protocol so that you can keep yourself healthy while you receive the chemotherapy. But if you have that, I'm sure your doctor's already suggested the chemotherapy protocol. And then, but again, when you do that, we have counterbalancing or cancer rehabilitation protocols to counteract the toxicity from chemo and to keep yourself healthy.
We do pushes after, which clears out the toxins. We do, helps the liver, I should say. We do oxygen therapies, and we do, alkalizing therapies. We do immune boosting therapies, and that's going to offset or mitigate the downside of the chemo. It's going to help your body stay strong through that process. So you get the benefit of the chemo, but not necessarily the full downside. And that's critical. And then, of course, you go back through the causes, and we try to figure out what may have created this, and we work through that process as well. So there is that kill effect, that chemo, which is, I think Dr. Connealy would say with triple negative is almost a must, right? Is that fair for most people? But then you have to pull in these adjunctive to be able to support the body and then clean it up. And that usually gives you the best chance.
Right.
Bottom line.
Now, a patient commented, or one of the participants commented, that she was able to, get rid of her triple negative with doing natural things, that's wonderful and great.
Yes.
So it just depends if you can partner with a physician who's watching you extremely closely. So a triple negative isn't anything and you have to look at the Ki-67. And
that's
make
the
sure
proliferation rate of those cells, gang.
Right.
Low, very good. High,
not
get a little nervous, right? Or a little more diligent, I guess is the best way to put it.
Right.
Prescribed chemotherapy, or probiotics during chemo.
No, definitely I would be doing
Support
probiotic.
your gut
Yes.
significantly. That's the one thing I see personally on the functional med side. Chemo really disrupts the digestive system quite a bit. The
Yeah, 'cause-
microbiome gets affected. We see leaky gut. And when I say microbiome, your good bacteria gets depleted. So we get more opportunistic bacteria, and then we could get candida overgrowth as a result. So you definitely want to support your digestive system when you're going through chemo.
Right. So if you're going through chemo, I would recommend you do aloe vera to accelerate the healing, and then definitely preserve with taking a regular, probiotic.
Biome is great.
Yes. So, and then the ion biome, it's a liquid that helps preserve the tight junctions of the intestines. So I think the more that you do to protect yourself, the better. I know, again, it's quite a few things, but
Yeah.
it's just you do far better when you are taking care of everything. So definitely do the probiotic.
CLL.
CLL, yes, you can successfully treat CLL. So of course, we'd be doing supportive therapies along with chemotherapy. Usually, a lot of times it depends on how high your number is, how high your white count is. And sometimes, depending on your particular situation, they'll monitor it. And then if it gets, the white count continues to go up, and then we can do either fractionated chemo or conventional chemotherapy and be very successful with that. And then also, again, addressing all the underlying features of the patient and creating health. And so I think that it can be very successly treated with either conventional chemo or low dose with the all mastering and taking care of your body while you're getting a very significant treatment. Just like if your doctor told you to take a medicine. So all medicines interfere with some enzyme function. Well, you need those enzyme functions for your body to take care of you. So, but the chemo is usually temporary. It's not usually patients are getting chemo for life. So anyway, squamous cell cancer on my forehead. So yes, usually a dermatologist would recommend you to get a surgical removal. So what I would do is I would do photobiomodulation. And so what that is we use a cream called aminolevulinic acid. It's called ALA cream. And what that does, we put that on the lesion, whether it's basal or squamous cell, or even skin damage, sun damage. And what we do is that we put that on, and after about 3 or 4 hours, we use laser light at different wavelengths, and that takes about 30 minutes. And it's very successful. So we can send you info on that to understand, but it's very effective. Yes. So that avoids surgeries and scars and stuff. Now, topically, for basal cell, I had patients use something called Curaderm, but for a squamous cell, I'd probably recommend that you do the endolaser, so the photobiomodulation.
All right, so Miss Carolyn, great to meet you. Nice to finally meet you last week. Carpets professionally clean. Any safe options that don't use chemicals?
That's a great question.
It's a tough one.
Well, first of all, I'm not very big fan of carpets.
Yeah, right.
Because carpets hold lots of dust and chemicals and bugs. So I personally don't have carpets in my household. So, and at the office here, we have, floors made out of stone just for that purpose, because our patients are very sensitive. So we don't, I'm sure, most carpet is not really, it's a lot of toxins. I know that they do make these great, beautiful wool carpets, but then how do you clean them, Now you can, I know they have non-toxic possibilities in this day and time, but I think.
Yeah, I'm personally not familiar with it.
Yeah, I read about a beautiful wool carpets probably 20 years ago, and I thought it was such a great idea. But I just now prefer not because of, it's a breeding ground for lots of bugs. So, all right.
Fish oil.
Yeah, I would do cod liver oil, like, at least 1 or 2 a day, depending upon your particular situation.
Could go
But
higher if you need
yeah,
more.
if you go higher, you need more. Exactly. I look at people's C-reactive protein to see if they need more, but every one of your cells. So your cell has a cell wall. All right. And the cell wall is made up of essential fatty acids. They call them essential because you have to have them. And then those are the bricks of the wall. Then the cement of the wall is something called phosphatidylcholine. And phosphatidylcholine is the cement that holds the wall together. So those two things, you want to have a good oil change because there's over 30,000 receptor sites that are all the hormones and everything, all the communication takes place on that. All the communication takes place on that cell wall.
So African snake root and cartitone, but having a problem with symptoms, bad anxiety and depression.
Interesting. I've
Yeah.
never heard of that.
Right.
So, because we use cartitone here and but just don't take it. There's other things. You can do Neo 40, you can do arginine. There's other things to use for lowering your blood pressure. So,
but to get out of the body, it shouldn't have that.
Yeah,
long
it
of a
won't
half-life.
stay. Yeah, it won't stay in the system, once you quit taking it.
Yeah.
So,
Natural alternatives to tamoxifen. Sure.
right. Some patients ask me about that. And so what I usually recommend as an alternative is something called myomin. And myomin is been used for quite some time to lower estrogen dominance and or ovarian cyst or as an estrogen blocker. So I always check the estrogen levels of the patients, their estradiol and their total estrogens. Also, Dr. Roney mentioned about doing a 24-hour urine. Those 2 things, 3 things actually will help in determining estrogen.
Yeah.
But myomin is a safe alternative. So, but again, everybody, it's a personal preference. And then physically, how do you feel?
Yeah.
Like you can try the tamoxifen and see, I always tell people start with the low dose, see how you feel, and then go up to the smaller doses, 10 milligrams, and go up to a higher dose, 20 milligrams, and then decide if that's the way to go for you. And if you just don't want to do the tamoxifen, then I'd recommend the myomin. But again, that's just one out of 100.
Right?
Yeah, there's 1 out of 100. That's 1/100th of the piece of the puzzle.
I had a patient today that had did lumpectomy, radiation, had a low KI score of less than 10%, which is not, the cells aren't proliferative. And let me think, what was the other variable? And had no circulating tumor cells. So her decision was, I'm going to hold on the tamoxifen and do the myomin and the DIM.
Right.
But there's variables that led her down that road.
Right.
So that, it's not for everybody. It just depends on, to Dr. Connealy's point, if your Ki 67 score is very high, right, that's a variable you want to consider. If the circulating tumor cells are high, it's another variable you want to consider. So anyway, figured I'd throw that in there. Fenbendazole.
So fenbendazole is in a group of class of drugs for parasites, but it also, like many parasite drugs, they block pathways to cancer. All right. So fenbendazole is just one of many. It's not bad. And you can do that. Usually we recommend 4 days on, 3 days off to kind of confuse the cell. And but there's about 310 drugs in the literature there are 310 drugs that block pathways to cancer and try to starve cancer. So, it's just one of many. So I wouldn't hang on my hat in just that one. So.
All right. So multiple myeloma, smoldering. I know we have patients currently with that diagnosis. So how do you, how do you basically, have you had success?
Yes, you can, especially if it's smoldering. You want to deal with that right away because First of all, multiple myeloma is a lot of times related. One of the culprits is heavy metals. So you want to make sure that the doctor has done a good heavy metal test. And also IV vitamin C, along with all the other things that we do, can be very, very successful. I know they have the conventional protocols for multiple myeloma, but again, if you even do that, and if it's smoldering, usually they don't recommend the conventional conventional medications. And so I would recommend that you try to, treat yourself with, peeling the onion and looking at all of the underlying features, do a heavy metal provocation test, heavy metals, mercury, lead, cadmium, and all the other many heavy metals can interfere with DNA replication and the Krebs cycle of energy. So we definitely need to be assessing every patient for heavy metals. So the EPA says there's no safe level of any heavy metal in the body.
Mhm. So this question, and I can help with this too, but it talked about insurance and the expense of the treatments and things like that. And definitely it can be cost prohibitive for patients. But one of the things that happens in the insurance world is they consistently reduce the reimbursement, right? So when, say, Dr. Connealy's seeing a patient, there's an hour or two before she sees the patient as far as getting prepped for the patient. There could be hours after the patient. It's not just the patient time, but they only reimburse for the patient time. And it goes down to really a very minimal reimbursement, which happens. So in order to have a building like this in a place like this, if you're in the insurance model, number one, they control everything. They tell you what you can and can't do. And number two, they control the reimbursement, which makes it almost impossible to give really good care. And that's the God's honest truth. That's what has happened in this insurance model world. They dictate it, which they tell us what we can and can't do, which then we're relying on their system that's quite honestly broken. Beyond broken, to then allow us to give you the best care. So we made a decision, last year collectively, we vetted this upside down and inside out. We made the decision that we in order for us to give you the best care
and the right care,
we had to be in control of that. Right. And so with that, it's a system problem. Unfortunately, we're the byproduct sometime of that system, in the sense that, yes, we understand the affordability, we understand all that, but at the end of the day, really the insurance company and the medical system is the culprit. They're the problem.
Right.
We can't navigate within their rules and still give you great care. We wouldn't be able to do it. It'd be impossible. So
I started practicing medicine in the days 37 years ago, and it was an indemnity plan. And so your hands weren't tied.
Right.
The doctor could practice the way he or she wanted to practice. But more importantly, when you billed for the visit, they paid for the visit completely. Mm-hmm. Now, if you get 20 cents for $20 for every $100 you bill, you're lucky. So, but we can't take care of patients like that. And all physicians are,
they're transitioning.
They're transitioning to go either a concierge model or a different kind of model, because you can't be taking care of patients when it's designed not to take care of you.
Right.
So U.S. ranks 43rd in the world in healthcare, 43rd. So it'd be better for you not to see a doctor, I hate to say, but it's the care is our care that we're delivering here. We're spending 2.5 times more than any other country, and we are delivering sick care. Mm-hmm. And we want to deliver health care and optimal care. So
great stat that I read the other day. North America consumes 66% of all the pharmaceutical drugs in the world, and we're less than 6% of the population. Not only that, we're one of the least healthiest nations in the world. That's so right. that just, when we evaluate all that, gang, and we go pretty deep into those stats, we realize that we're not going to be able to follow that model and still be able to get people well. yes, we understand the dollars and cents of it. And I tell everybody, as if, I'm as honest as I can. If I had to go out and even fundraise for my care because I believe in it that much, I would do whatever it takes. Now, I'm not saying you do that. I'm just saying the conviction on our end is that strong that I would do whatever it takes to try to get this type of care and use that system for what it's good for, which is the sick care and the emergency care like chemo, surgery, and radiation. But then use this side if you needed to do that. Then use this side for your integrative healthcare.
Right.
Healthcare, right? Not sick care. So we're delivering healthcare. Okay.
So Renee said hello, right?
Oh yeah, sorry. Did I miss that one?
Yeah, no, she just said.
Oh, hey
hi.
Renee.
Hi. So anyway,
Insurance
So,
laws, right?
yeah,
Each state.
well, he said they need to change because they need to be changing the model we need to be doing a whole different model. And it really needs to start. I just saw, I get this global health newsletter. And now there's a startup for fertility, and it's going to be consisting of how to clean up the mom and dad. And I was like, oh, thank you. This is phenomenal,
right.
Because we wouldn't have sick people if we started cleaning up mom and dad, so they'd have this incredibly healthy baby.
Yeah,
so,
I agree.
And then if the parents would follow the rules of, the proper, lifestyle intervention that everyone needs, from proper sleep to proper eating, proper rest, proper everything, the whole environment needs to completely change, but it needs to start with getting healthy parents and then creating a baby. So
gang, to parlay, the pandemic was no better example. Like we were frustrated during the pandemic quite a bit on how it was handled. Cancer care is very similar. It's one chapter that they're working on of a 20 chapter book, right? So it's like, hey, this one cause, one cure, we're going to go after this one cause, one cure. But yet we did nothing over the couple years of educating people on better health and how to, better eating and better exercise and the vitamin D's and the C's and even the ivermectins and the hydroxychloroquine, which are now part of the protocol. Right. So you get that. And then you look at cancer care, which is very similar in the sense that it's chemo, surgery, and radiation, but none of this that we're talking about now. We're hopeful that someday with movements like this, that you all go back to the doctors and almost, what's the word I'll use? Like require it, that you push for it. And then maybe that will make the change over time. But it's just, we are here where we are and we'll do the best we can.
Yeah. So. And there's lots of people trying to change, the system. And so, but it starts with you and demanding a different product.
That's right.
And
that's
that's the way it has to be. It's just like at the grocery store, you have to demand organic.
Yeah.
You can't go and buy, you can't support the things that are not going to be part of your healing existence. So dysplasia left untreated. No, not necessarily. If you change the environment of these cells, and I'm not sure if you have dysplasia of what, I'm thinking it's the cervical dysplasia, maybe
just cellular dysplasia on the skin.
I'm not really sure, but definitely you can. One of the best things to change dysplasia is doing folic acid, whether that's in the colon or whether that's cervical. So you can write us back and let us know. We have a healing the cervix protocol that patients can do. So I'm not sure where the dysplasia is.
But if you have dysplasia, not to cut you off, there's again reasons for it, right? Cells stay healthy if the environment is conducive for that. So
and your body's under constant repair and regeneration.
Yeah.
So if you're nudging it in the right direction, it's going to take care of you. If you're doing things that breaking the rules and not following and stewarding your body, things are going to change.
We have a couple more. We're about 5 after 6, so we'll try to get a few more if we can.
So what does it mean if your troponin increases from 6 to 21? Wow, in 90 days. Well, that's a cardiovascular parameter. So I would think you would need maybe a good cardiovascular workup, doing a heart scan of your heart to see if there's any calcifications in your arteries, then doing blood, good blood work. There's certain cardiovascular parameters that we do here to look for cardiovascular disease. Definitely need to get a cardiovascular workup for sure, to make sure, but start with the calcium score, and then you got to find an integrative cardiologist, which they do exist, believe it or not. And so to find out why you're having elevated troponin. So.
All right, couple more. Keytruda.
Keytruda is in the new class of immunotherapy, and it can be very, very helpful in very, very complicated cases. I know that they're adding it now to even breast cancer and some of the other cancers now. First of all, it was drug use for, melanoma, but it can be very helpful in patients with bladder cancer. But now they've expanded the use of Keytruda now for quite some time. So again, patients can have a unusual reaction to Keytruda. So when these drugs first came out, and Keytruda was the first one, they were giving a different dose and they saw, an abnormal reaction. Well, now they've lowered the dose and they start a patient slowly, so they don't get any of these, abnormal, very serious abnormal situations so that the patient doesn't end up in the hospital or anything. So that's all been controlled. It is a new drug, so it's only been in the last 5 years. So I tell people anything new, we have to err on the side of caution. And so, again, you want to take all the proper support while you do it, because Keytruda is not the kind of drug that you take forever. So. Adrenal and pituitary, that is a very big question. Adrenal is very, very complicated because adrenal are your stress glands. And so
pituitary is related.
Yes, pituitary is your
axis.
master gland. So it's your master gland sending out all kinds of releasing hormones to stimulate the stimulating hormones to turn on and off your body. So that is a all-encompassing talk. Adrenal. Pituitary insufficiency, I know I've had that. So I had to have I delivered twins 28 years ago, and I went into shock from the delivery, and I was sick for like 7 years, and I went to doctor, and then this one said try this one said this one, anyway, come to find out I had Sheehan syndrome, where your pituitary shuts down. And I ended up getting a pituitary transplant, and that was very successful. And it was like a miracle that happened. So anyway, is having a low VEGF a problem? No, that's no, not a bad problem at all. That's good. We look for elevated VEGF. So that's a vascular endothelial growth factor. So.
All right, last one. It's patient family Lynch syndrome, MTHFR, brother had surgery for colon cancer, 33, looking to avoid colonoscopy if possible. Would you recommend Cologuard?
Yes, I love Cologuard. We've been using it since when I read the studies of the false positive and false negatives. I said, this is a great test. In fact, we had 2 of our staff members one gentleman had a positive Cologuard. We immediately did OncoTrace, which is the liquid biopsy. The liquid biopsy said he doesn't have anything. So the doctor said, "Oh, we go in there," and they did the colonoscopy, and they said, "Oh, you have a big polyp. I want to remove it surgically." They went in and removed it surgically, and it was no cancer whatsoever. So it shows you the accuracy of the test. I had another lady who her mother had colon cancer. She did Cologuard, and she also had polyps. So even for polyps, Cologuard is pretty, scrutinizing. So I love Cologuard because it's a great way to look. But if you have a genetic tendency, you need to you
diligent.
you need to be looking at your exposome.
Mhm.
The exposome is everything that you're exposed to that could turn on these genes.
Mhm.
So that's what they're saying is now for a long time is what's influencing how your DNA is being replicated every day to create abnormal DNA is your exposome. Exposomes is everything you've been exposed to from in utero.
There's a saying, genes load the gun and then lifestyle pulls the trigger.
Right.
So to that point, recommendations for proactive prevention is better eating, better exercise. We're looking at going with a functional medicine provider that can look at your stress, your hormones, your gut health, your chemicals, your toxins. With Lynch syndrome, I think you're just, you have to be more diligent, quite frankly, with that genetic predisposition. So, okay, gang, that is going to wrap it up for tonight. Let me go to, let's see, share the screen with you here somewhere. And let me go to the last slide and let you know, because we always get questions the next day as far as who do we call, who do we talk to? So I just want to make sure we can do that for you. There we go. Okay, so for inquiries for the Cancer Center for Healing, if you have active cancer and you're looking for a plan, 949-867-6374, that's Dana. If you're prevention on the preventative side or preventing reoccurrence, 949-867-6419, that is Miles. He'll help you with that. And anything related to the Perfectly Healthy store, 949-997-0821. So that at least gives you,
people can take a picture.
Yeah, exactly. So if you
Save it
need
on your
anything, gang, let us know. We're always here. We're always happy to help. We'll get the other questions answered for sure. Send out a video. But listen, thanks for tuning in, right? It's great that you're being proactive with this, whether you have active cancer or not. You need that active participation. The empowerment with this information gives you control. And that's a big part of what we want to be able to facilitate for you. So on behalf of myself, Dr. Connealy, have a great couple weeks. We'll see you in 2 weeks. Shep will put out the information on the next cancer conversation. And as always, we wish you the best. Okay.
Yes.
Keep fighting the fight.
And thank you for being part of our incredible organization and spreading the word so that we can change millions and billions of lives.
Got to do it one day at a time. One day at a time. All right, gang. Have a great week. Okay. Take care.